Hello and welcome to Fix Your Smile. All right, let's talk about something that sounds scary but really isn't: root canals. The very words can make you cringe, right? You've probably heard the horror stories, maybe from a grandparent who had one done decades ago, or seen it used as a punchline in movies for something truly awful. You've probably heard people say they'd rather do anything than get a root canal. But here's the secret dentists want you to know: that reputation is completely outdated. Modern dentistry has transformed this procedure from something to be feared into a routine, pain-relieving treatment. So let's start by busting the biggest myth of all: that root canals are painful. This is the #1 fear we hear from patients. But the truth is, the procedure itself is what gets you of pain. The excruciating pain people associate with root canals is actually caused by the infection in the tooth. The root canal treatment is designed to remove that infection and, with it, the source of the pain. Thanks to incredibly effective local anesthetics, you shouldn't feel any pain during the procedure. Most patients describe the sensation as being similar to getting a routine filling. Another common myth is that it's just better to pull the tooth and be done with it. While an extraction might seem like a quicker fix, saving your natural tooth is almost always the best option. Your own teeth are stronger and more efficient for chewing than any artificial replacement. Losing a tooth can cause a chain reaction of problems. Neighboring teeth can shift and drift into the empty space, affecting your bite and alignment. This can lead to jaw problems and make it harder to chew. A root canal saves your natural tooth, preserving your smile and the healthy structure of your jaw. Finally, you may have even heard scary claims online linking root canals to other illnesses in the body. This is based on long debunked research from 100 years ago, long before modern medicine understood the causes of disease. There is absolutely no valid scientific evidence to support this claim. Major dental and medical organizations have all confirmed that root canals are a safe and effective procedure. In fact, by a source of infection, a root canal actually improves your overall health. So, with those myths out of the way, let's get into the specifics. What exactly is a root canal? And more importantly, how do you know if you might need one? Your body is usually pretty good at sending signals when something is wrong, and a tooth infection is no exception. One of the most common signs is a severe, persistent toothache. This isn't just a minor twinge. It's a throbbing pain that can wake you up at night, especially when you bite down or apply pressure. Another huge red flag is prolonged sensitivity to hot or cold. We all get a little sensitive sometimes, but if the pain from a sip of hot coffee or a bite of ice cream lingers for more than 30 seconds after the food is gone, that's a strong indicator that the nerve inside your tooth is in trouble. You might also notice the tooth itself starting to look different. It might darken, turning a grayish color. This happens because the dying pulp inside is breaking down. Also, look at your gums. Swelling, tenderness, or what looks like a small pimple on the gum near the painful tooth is a classic sign of an abscess, a pocket of pus from the infection trying to find a way out. If you see any of these signs, it's time to call your dentist right away. To understand why these symptoms happen, let's look inside the tooth. Imagine your tooth like a tiny, multi-layered fortress. The outer layer is the enamel, the hardest substance in your body, acting as the main wall. Beneath that is a softer layer called dentin, which has microscopic tubules leading to the center. And deep inside, at the very core, is a soft living tissue called the pulp. This is the command center of your tooth. The pulp contains nerves, which give your tooth the ability to feel temperature and pressure, and blood vessels, which keep the tooth alive and healthy. This pulp extends from the main chamber down through narrow channels in the roots of your tooth called root canals. This fortress is usually impenetrable. But if bacteria manage to sneak past the defenses, usually because of a deep cavity that has eroded through the enamel and dentin, or a crack from an injury or from grinding your teeth, or even due to repeated dental work on the same tooth, those bacteria can invade the pulp. Once inside, they multiply, and that pulp gets infected and inflamed. Your body's immune system tries to fight it, but because the pulp is trapped inside the hard walls of the tooth, the inflammation creates immense pressure. That pressure on the nerves is what causes the intense pain. If left untreated, the pulp will die, and the infection can spread out from the tip of the root into your jawbone, forming a painful abscess. This can lead to bone loss and can even spread to other parts of your body, becoming a serious health risk. And that's when you need a root canal, not just to stop the pain, but to save the tooth and eliminate the infection for good. So, you have the symptoms, and your dentist confirms you need a root canal. What happens next? Let's walk through the entire journey, starting with what to expect before you even sit in the chair. Your first appointment will be a consultation. Your dentist will carefully examine the tooth and the surrounding gums. They'll take digital X-rays, which are crucial. These images allow them to see the exact shape of the root canals and determine if the infection has spread to the surrounding bone. They might also perform a few simple tests, like tapping on the tooth or applying a cold stimulus to confirm that the pulp is damaged. This is your time to ask any and all questions. Don't be shy. Understanding the process is key to feeling comfortable. Depending on the situation, your dentist might prescribe antibiotics for a few days before the procedure to help control the infection, or an anti-inflammatory to reduce discomfort. Just follow their instructions, and you'll be setting yourself up for a smooth experience. On the day of the procedure, here's how it goes, step by step. First, and most importantly, your dentist will numb the area completely with local anesthetic. They'll apply a topical jelly first, so you barely feel the injection, and they won't start until you are profoundly numb. You won't feel any pain, just some pressure and vibration. To keep the area clean and dry, your dentist will place a small sheet of rubber, called a dental dam, over your mouth. It isolates the single tooth they're working on. This is great because it prevents any bacteria from your saliva from getting into the tooth, and it ensures you don't taste or swallow any of the materials used. Seriously, the worst part for most people is just holding their mouth open for a while, and your dentist will give you breaks for that. Next, they'll make a small, precise opening in the top of your tooth to reach the infected pulp chamber. Then, using a series of very fine, flexible instruments called files, they will carefully and meticulously remove the infected and dead pulp tissue from inside the pulp chamber and the root canals. It's kind of like clearing out the bad stuff from the middle of a jelly donut, but far more precise. As they clean, they also shape the inside of the canals. This isn't just random, it's to prepare the canals to be perfectly sealed later on. Throughout this process, they will periodically flush the canals with a disinfecting solution. This irrigation is critical. It washes away any remaining debris and bacteria, ensuring the inside of your tooth is sterile. Once the canals are squeaky, clean, dry, and properly shaped, it's time to fill them. The space is filled with a biocompatible rubbery material called gutta percha. The gutta percha is often warmed and then compacted into the canals along with a special sealer cement. This combination fills the entire root canal system from top to bottom, creating a complete, watertight seal. This seals it up tight and keeps out any future invaders. Finally, a temporary or permanent filling is placed in the opening on top of the tooth. In most cases, the tooth will need a permanent crown to protect it. A tooth that has had a root canal is no longer vital and can become brittle over time. The crown acts like a helmet, protecting the tooth from fracturing and restoring it to full function. This is usually done in a second appointment after the tooth has had time to settle. And that's the procedure. But what about recovery? For the first few hours, your mouth will still be numb, so be careful not to bite your cheek or tongue. As the anesthetic wears off, it's normal to feel some mild tenderness or sensitivity in the area for a few days, especially if there was significant pain or infection beforehand. This is just your body's natural healing process and can easily be managed with over-the-counter pain relievers like ibuprofen. try to chew on the other side of your mouth until your dentist places the permanent crown. It's crucial to follow through with that final restoration. The temporary filling is not meant to last, and delaying the crown puts your newly saved tooth at risk of fracture. With the crown in place, you save your natural tooth, avoid more pain, and get back to chewing like normal. Now, while root canals have a very high success rate, over 95%, it's good to know what to watch for afterward. Complications are rare, but you should call your dentist if you experience severe pain or pressure that lasts for more than a few days. If you notice visible swelling inside or outside your mouth, or if your bite feels uneven after the treatment. Also, if your temporary filling or crown comes out, get in touch with them right away. These issues are usually simple to address, but prompt communication is key. So, next time you hear the words root canal, don't panic. Remember what it really is, a pain-relieving procedure that removes a harmful infection and, most importantly, saves your natural tooth. It's a straightforward fix that can preserve your smile for a lifetime. A tooth with a root canal and crown needs the same care as all your other teeth. Consistent brushing, daily flossing, and regular checkups. Taking care of a small problem today prevents a much bigger one tomorrow. Thanks for watching, and don't forget to smile, like, share, and subscribe. Take care of those teeth.